Health Minister Zweli Mkhize has announced that the Pfizer vaccine will arrive in South Africa in May. The news comes after the minister said yesterday the use of the Johnson & Johnson vaccine would be suspended following blood clot concerns in the US and Europe. eNCA's Heidi Giokos is tracking that story and joins us now from our newsroom with an update. And Heidi, the minister announcing that more Pfizer vaccines have been secured for South Africa. This is a bit of good news, right? Should the J&J vaccine continue to be halted?
Yes, most certainly. To us in Parliament today, we do know that the Health Minister, Dr. Zweli Mkhize, he also announced this last night, but he just gave more clarity this morning with regards to additional Pfizer vaccines that will be coming into the country. So instead of 20 million Pfizer vaccines, we will be getting 30 million, which will mean that 15 million South Africans will be inoculated instead of 10 million. One must remember that the Pfizer vaccine is 2 jabs, so of course this is why it's only 15 million that will be vaccinated from the 30 million doses that we will be receiving. The Health Minister also giving a clear summary and indication of how many vaccines we will be receiving. It seems as though from as early as the 3rd of May to about the end of May, we will be receiving doses every week, and that will most likely double in the month of June. We do know that for Q2, we will most likely be receiving about 6.5 million Pfizer vaccines. I'm so used to saying Johnson & Johnson, but the focus now is most likely going to be on Pfizer until a further decision has been made on the J&J. But let's listen to what the Minister had to say about further procuring of Pfizer.
It gives me pleasure to also announce that we have received a formal acceptance and confirmation from Pfizer to increase their doses from 20 million to 30 million. This therefore means that we can now guarantee that the number of people that will be vaccinated with the Pfizer increase now from 10 million to 15 million. I'm also pleased that Pfizer has also given us a weekly delivery schedule for Q2. The current weekly schedule, delivery schedule for Q2 under the existing supply agreement is confirmed as follows. On the 3rd of May, we receive 325,260 vaccines. The following week, on the 10th, we received the same amount, 325,260. The following week, the 17th, on the 5th of May 2021, we get the same amount, 325,260,000. On the 24th, we received the same amount, 325,260. Then on the 31st of May, that the amount is almost double.
And also we have some good news in the sense that the country is being refunded for the AstraZeneca vaccine as well, Heidi?
Yes, certainly, Tulas, and I think this is some good news given the fact that there was a huge concern with regards to what was going to happen with the AstraZeneca vaccines, given the fact that it was put on hold here in South Africa, and then we know the 1.1 million doses were sold to the AU. But the Minister has indicated that we have been given the full amount that we paid for. It's about $5 million US that we have received from the AU for the 1.1 million doses of the AstraZeneca vaccine. And also we have received a refund from the Serum Institute of India for the 500,000 doses that were not delivered, but of course ordered by the South African government. The Health Minister also saying that we have avoided, of course, the wasteful expenditure in the country because we were able to get that money back. So at least we have some money in the bank to make sure that we're able to also buy other vaccines. But let's listen to the Health Minister once again on that.
With regards to the AstraZeneca refund, I can confirm that in March already we received a payment for the full AU 1 million doses which we sold to them. The amount paid was $5,250,000 US. This was the actual cost of the vaccines minus the freight. Last week, we were then refunded by the Serum Institute of India of the 500,000 doses that were not delivered in the amount of $2.675 million. We are therefore happy that we have avoided what could have been viewed as a fruitless or wasteful expenditure. Honourable Chairperson, it is also important for me to also mention that the Johnson & Johnson and the Pfizer agreements have non-refundability clauses. The agreement specifically states that down payments that have been made in advance by the department shall not be refundable by the manufacturer to us in any circumstances. This is another onerous term that we have had to settle for, and to give members comfort, we did check with other jurisdictions if these terms had come through in the agreements, and it appears to be the case. We are aware, for example, that the agreements that have been signed with the African Union platform are similar to what we have signed, and in our consultations with the COVAX facility, we found out that a number of these onerous preconditions were also experienced by them.
Heidi, do we know what happens now? Has the minister indicated when the rollout will resume? You know, working on the assumption that the next batch from Pfizer, the first batch from Pfizer is expected on the 3rd of May.
Well, what's key here, Tules, is that we have 110 Johnson & Johnson vaccines arriving in the country today, and the minister also indicating in Parliament this morning that over 1 million doses of the Johnson & Johnson vaccine is still arriving as early as next week. So we have the J&J vaccines in the country as we speak, but of course government has decided to halt the eNCA trial until they take a further decision on the advice given by the FDA with regards to 6 cases which have recorded blood clots, but they're saying that it's not likely that it's directly linked to the J&J vaccines, but they wanted to rather be safe, and this is why they've decided to halt the vaccine for now. But we know that the health minister says that there are ongoing meetings with J&J and other officials, and government is meeting to decide whether or not they're going to continue with J&J. But yesterday, Tulis, the minister was quite confident when he addressed the nation to say that it's unlikely that the J&J vaccine will be halted permanently. This is just a temporary precaution to determine what science is actually indicating. There have been no cases in South Africa to show adverse symptoms or side effects such as blood clotting. It's just the normal side effects that a number of healthcare workers have indicated, and the over 290,000 healthcare workers that have already been inoculated, nobody has reported any blood clotting. So I think the next 48 hours are going to be crucial for government to decide what they are going to do, given we have already secured these J&J vaccines and we have paid for them. And as you heard the minister saying in that previous soundbite, we have a non-refundable condition attached to our J&J agreement. So we'll just have to wait and see what the minister and government decides in the next couple of hours.
Yeah, you're absolutely right. I mean, we've already procured, we are told, some 30 million doses of that Johnson & Johnson vaccine, and therefore the stakes couldn't be higher. We are scheduled to speak a bit later on to Dr. Linda Gale Becker to just get a sense of where we stand at the moment with the eNCA vaccine program. That interview is scheduled to take place within this hour.